In this video, we're going to be looking at our first psychological therapy for schizophrenia, which is CBT. I know that you have come across CBT elsewhere in the course when we looked at the cognitive approach to explaining and treating depression, but it is a little bit different for psychosis and for the treatment of schizophrenia, so it's really important that you pick up on the subtleties here and that you're explaining CBT for psychosis rather than just general CBT. So, when we're talking about CBT, it is the main psychological treatment for schizophrenia and aims to help schizophrenia by changing the maladaptive thinking and the distorted perceptions that are seen as underpinning the disorder in order to modify hallucinations and delusional thinking. It involves making sense of the delusions and hallucinations. Just understanding where the symptoms come from can be hugely beneficial for those who have symptoms like auditory hallucinations. So if, for example, a client hears voices and believes that voices represent demonic forces, they will naturally be really afraid. So if a therapist can convince them that the voice actually comes from the malfunctioning speech center in their own brain, and that it cannot hurt them if they ignore it, then this is much less frightening and hence less disabling. So this is going to improve their functioning. It also involves some sort of argument or discussion of how true a patient's thoughts might be. So together, the therapist and the client are going to be using perhaps Socratic questioning, so questions followed by questions followed by questions to really get down to the bottom of the delusional thinking. And they might together come up with a percentage likelihood of a belief, of the belief that they think that delusion is true. So if, for example, I'm 60% sure that I'm being followed by the mafia, for example. And then they're going to look at considerations for less threatening possible explanations. So they're going to look at the evidence for and the evidence against that delusional thought being true. And then together they might reassess and again come up with a percentage likelihood of how true and how likely it is that belief is true. Of course, CBT, the B stands for behavior therapy, and so there's also an emphasis on replacing maladaptive behaviors with more helpful ones. And so it really focuses on trying to identify the thoughts and how that can influence on the feelings and the behaviors. And so they're going to help focus on maladaptive behaviors as well, such as not being able to go to work or maintain friendships. And it will be the job of the therapist to set homework assignments to help target these maladaptive behaviors. So as we know, CBT doesn't remove symptoms necessarily. It does help to improve symptoms and does help, as we know from self-report, the distress associated with these symptoms, but it does allow the sufferer to cope better. It reduces their distress and improves their ability to function. So this is a common diagram that you're going to see with all different types of CBT. This one in particular is for CBTP, CBT for psychosis. And these sorts of drawings or diagrams are often used to display the links between the sufferer's thoughts, behaviours, actions and emotions. So very, very similar to the whole ABC model and looking at how your beliefs can influence on various consequences, emotional and behavioural, for example. And so for psychosis, a trigger might be not sleeping for a few days, and that's going to lead to the hearing of critical voices. So for example, it could be demonic voices. The thought then is, the devil is talking to me, and this is the irrational belief that is going to be targeted by the therapist in CBTP. Then they're going to assess how that's influencing on their behaviour. So for example, that could be self-harm or withdrawal. And then this is going to make them obviously feel quite anxious and distressed and could feel shameful as well. And so quite often the therapist and the client together will have a look at the interplay here between perhaps triggers and the symptoms and then the behaviours and the thoughts and the feelings as well to see how this all relates to one another. And this can help lessen the anxiety and the distress, because if the sufferer can understand that there's an environmental trigger, well then they can make sense of it a little bit more. So it's not necessarily eliminating the hallucinations, but it's making people better able to cope with them by reducing their distress and improving their ability to function. So CBT, it's conducted every 10 to 14 days. You go through a cycle of approximately 12 sessions, but obviously this can be extended depending on the severity and depending on how successful it can be. It's often done group or individually. Again, this is going to depend on the severity of the case. And it can be done in person, or it can be done via telephone. It could be done online now. And so there's lots of different methods for CBT. And as we know, CBT requires a lot of motivation, and we'll talk about that in a moment. And so for particularly, for delusions that are particularly resistant to reality testing, they might prescribe antipsychotic drugs in the first instance to reduce the psychotic thoughts so that CBT can be more effective. But for people who are suffering from delusions that are really persistent and resistant to reality testing, CBT can still be used to tackle the anxiety and the depression that results from living with schizophrenia. So even in those cases, it can still be used to help improve functioning and quality of life. So I just wanted to give you a transcript of CBTP in action, CBT for psychosis. So Tony here is our therapist, and Caesar is our patient with schizophrenia. And I would really urge you to pause and have a read through so you can see that there's lots of questioning. And it's really just putting that back on Caesar to assess the strength and the likelihood that Caesar's beliefs are true. One thing to note here is this little phrase, or this little comment here by Tony, talking about hearing voices, saying that actually it's really common to hear things that other people can't hear, especially when stressed, and saying that I've heard a voice before. So this process is called normalization. And it's basically trying to teach the person that voice hearing is an extension of ordinary experience of thinking in words. And so this can help lessen the anxiety, lessen the distress, by letting them know that what they're experiencing is not uncommon and that they are able to cope with it. You can see here that the delusions are being challenged, so they're going through a process of reality testing. So the person with schizophrenia, in this case Caesar, and his therapist Tony, jointly examine the likelihood that the beliefs are true. So what you can see here is another diagram where we're looking at the link between some sort of trigger, a belief, or in this case, delusional thinking, the effect on behavior, and the effect on feelings or emotions. So together they've been able to draw this up to make better sense of what effect these delusions are having on the person's ability to function. So together they explore the evidence. Here they've said there's a 90% likelihood that the delusional thinking is true, that kids are sending messages via their telephone or telepathically. So together the therapist and the client examine the evidence for, examine the evidence against. So they're doing this collaboratively, and this is why sometimes it's called collaborative empiricism, because they're really approaching these thoughts like a hypothesis and like scientists would approach a research question. And so they're really trying to find all of the evidence for and all of the evidence against. And doing this can mean that the person then is less certain that those delusional thoughts are true. Basically, they're learning to outrank their thoughts. And so realize that they can replace those irrational beliefs and those delusions with more rational ones. In this case, the belief that it's an auditory hallucination, which now is held as a more firmly held belief than the delusions that the kids at school are sending messages. And so it's really helpful to understand exactly how this relates to psychosis, because it's not exactly the same as it applies to depression. Okay, so let's evaluate then. Again, you can't just use your AO3 of CBT for depression because it is different. We're looking at different research evidence and the same rules don't necessarily apply to schizophrenia. So there is research support to show that CBT can be effective. So in this meta-analysis by Juaha, I'm not sure exactly if that's how you pronounce it, but in this research he reviewed 34 studies using CBT with schizophrenia and concluded that there's clear evidence for small but significant effects on both positive and negative symptoms. Now that part is particularly important because research prior to this really just focused on positive symptoms, looking at how it can reduce the frequency and severity of auditory hallucinations, for example. But in this research, it also has an effect on negative symptoms, for example, avolition. And it's also really important to know that clinical advice from NICE, the National Institute for Health and Care Excellence, recommends CBT for schizophrenia. So this means that Both research and clinical experience support the benefits of CBT for use with people with schizophrenia. So overall, it is the most common psychological therapy for schizophrenia, and it does have a small but significant effect on both positive and negative symptoms, and is currently recommended by mental health experts. One thing to note though, I'm just going to put an exclamation mark here, is that we do have to question the quality of evidence. As we know, schizophrenia has a large range of symptoms that are unique and differ from person to person. Some people experience catatonia, some people mostly experience disorganized thinking, some people experience mostly hallucinations or delusions. So the experience of schizophrenia differs widely from person to person. The strategies and techniques that are used in CBT also varies drastically. So some therapists are going to focus more on this collaborative empiricism, others are going to focus more on the diagrams and showing the sufferer the link between their thoughts and their feelings and behaviours, for example. And so CBT differs significantly from therapist to therapist. When we're combining that with the fact that schizophrenia people with schizophrenia have different combinations of positive and negative symptoms and different severities, it makes the picture very, very confusing. Overall, the modest benefits of CBT probably conceal the wide variety of effects of different CBT techniques on different symptoms. And so it might be impossible to determine how successful CBT is going to be for any particular person with schizophrenia. And so we just do have to question that the quality of evidence is not strong, given that schizophrenia varies widely, as well as CBT. One of the other main benefits is that there are no side effects, particularly when we compare this to drug therapies. There is no risk of death, there is no risk of life-changing diseases, and so for some this could be a preferred treatment. However, as we know from CBT when we looked at depression, we know that it requires motivation and engagement. Now, this is particularly a concern for CBT for psychosis. People who are suffering from schizophrenia are likely to suffer from positive symptoms. They're likely to suffer from delusional thinking and also hallucinations, for example, auditory hallucinations. This can mean that they actually lack insight into their illness. For example, they might believe that the therapist who is providing the CBT is actually a Russian agent. And this can make it very, very difficult for them to examine their beliefs, to examine the likelihood that their delusions are true, and then to actually engage in this reality testing. And so it can be really difficult for people with positive symptoms to engage in the process because they lack insight into their symptoms. Similarly, people with negative symptoms like avolition can be really reluctant to take part. We know that it requires 12 to 15 sessions, for example, every 10 to 14 days. And this can be really, really difficult for somebody who is suffering from the lack of motivation that comes with schizophrenia. So CBT might not be appropriate for all patients. If there are patients who are particularly disoriented or agitated or suffering from paranoid delusions, then it may not be the best and first option. Often then we would obviously prescribe antipsychotics to make the therapy more accessible. But there are some particular limitations when it comes to CBT for psychosis. And the other thing to remember is that it is not a cure. So it is going to improve the quality of life for people with schizophrenia, but it's not actually going to cure them. As schizophrenia appears to be largely a biological condition, we would expect that a psychological therapy like CBT just benefits people by improving their ability to live and cope with the symptoms. On the other hand, studies do report significant reductions in the severity of positive and negative symptoms. So maybe it does more than just enhance coping, but nevertheless, it's not going to cure them of the disorder. And it doesn't necessarily reduce the intensity of the hallucinations. It's not going to quieten down the auditory hallucinations, but it can make them less distressing by allowing the person to understand where they might come from and understand the triggers for them. This can help them to outrank those voices in their head and to understand that despite the fact that they may not go away, they're able to live with them